Hello, this is Dr. Anthony Arion. I want to address compliance challenges when one is asked to take certain medications for a lifetime. Nobody wants to have to take a medication every day for the rest of his life. Unfortunately, it's a reality that we may occasionally have to face. These are usually recommended for conditions that cure is not possible. The good thing is that for these conditions, once managed properly with these medications, one can still live to his ripe old age without it being the cause of his death. What are these conditions that may warrant lifelong medications? Medications may be prescribed for the rest of life for hypertension, diabetes, asthma, or chronic airway disease. Other conditions include some heart conditions and for those who have been diagnosed of HIV. There are those who have to take blood thinners for the rest of their life to prevent stroke, heart attack, or deep vein thrombosis. Or those who have problems with their thyroid or their thyroid has been removed. Other conditions that may warrant taking such medications include those that have had kidney transplant or any other organ transplanted, or for those who have convulsion disorders, and those who have mental health challenges. The lists are endless, but the same principle applies. Compliance is key to achieving the desired aim. However, compliance may not be easy, especially when one has been asked to take more than one medication. The gains desired in treating such conditions is highly dependent on continued use of the prescribed medications to suppress its effects on your life to achieve stability. The consequences of not taking these medications varies. In some conditions, there is a gradual development of irreversible complications that will ultimately worsen one's health. This is what happens in cases of hypertension and diabetes. In some other conditions, there is a sudden catastrophic deterioration in health once these pills are mixed. And this could happen in cases where someone whose thyroid has been removed misses his pills. The delayed manifestation of the consequences of not taking these medications in some conditions may give the illusion as though the medication was after all not as important as highlighted by the doctor. Unfortunately, when they begin to manifest, it would have been too late, as irreversible damages complicating the whole condition would have happened. And sudden repentance and beginning to judiciously take this medication does not achieve the same goal that was set out to be achieved with them, and does not reverse most of the complications that would have started. So, if your doctor has recommended that you take certain medications for the rest of your life, it is okay to seek second opinion if you have your doubts, but do not disregard such recommendations. Watch the part 2 of this video as we provide you with valuable tips on how to comply with such medications. And this is Dr. Anthony Arion, adding to health and social literacy. Thank you.